All right, everybody, today we will talk about epilepsy treatment. Uh, can you tell me in the, because you know about a lot of classes of drugs, right? So can you tell me in the text message that what do you think? Okay, good, Tuba. All right, guys, I want you all, okay, to tell me in the message, okay, to tell me in the chat box um, that how exactly you would be treating epilepsy. Come on, guys, because right now you have learned a huge number of classes of drugs, so you must tell that what should be the mechanism. I'm waiting for your responses in the chat box. Anti beta, look, when we are dealing with epilepsy treatment, okay, so epilepsy is already convulsion, okay, so Eamon, when you're saying it's anticonvulsant, so it's already a huge class of medicine, okay. For example, you would commonly hear anticonvulsant drug or anti-epilepsy drug, okay, that is AED. All right. All right, Anusha said benzodiazepines, very good. Epilepsy, Rabia said epilepsy means phobia, brain conditions that cause damage to brain such as tumor can cause epilepsy. Rabia, first of all, who told you that epilepsy means phobia? Epilepsy, I don't know. I don't think so. It means phobia, because phobia means that you are hating something, okay? And this is not a hate or love situation. This is more kind of a condition in which the body is jerking and everything. Tuba beta, AED refers to anti-epileptic drug, okay? So stop Googling and start thinking, what would you give? Amen said Caesars. Beta, is that what you'll give to the patient? Anusha said drugs that induce inhibitory neurotransmitters. Uh, Anusha, if I had a recording of clapping, so I would have played that for you right now, because yes, we are going to do that, right? Guys, in my last lecture, I told you all that epilepsy is all about the neurotransmissions getting crazily excited, okay? And because of the excitation, there are the epileptic jerks and everything, all right? And when we are trying to diminish epilepsy, okay, so here we are talking about the anti-epilepsy. It means that we can give two kinds of drugs, right? Either the one that would diminish the excitation, right? And how would they diminish the excitation? What do you think? How would they diminish the excitation? How would you think they would diminish the excitation? What kind of medicine can I give in order to block excitation, guys? What kind of a receptor I should block? I've been teaching you for so long about this thing. I showed even you the receptor, how it works and everything in my previous classes. Remember that NMDA receptor that had calcium in it, and then sorry, that had magnesium in it, and as it was getting out influx of excitatory ions were there, right? And that influx of the ions was due to the neurotransmitter, the excitatory neurotransmitter that is called glutamate, right? Okay, so my one strategy could be that my brain is producing excitatory neurotransmitters and I'm trying to block its action. So I would give medicine such that that would block the excitatory receptors, right? The other action could be that I induce inhibitory neurotransmitter, like Anusha said, that I would give the medicines that would enhance inhibition, right? Inhibitory effects. Can you guys tell me name of class of drugs that produce inhibitory effects? You studied that already in antidepressants. Sorry, Sorry, you studied that in hypnotic, yeah, sedative and hypnotic drugs. Come on, guys. Now, what more hint should I give? Very good, Anusha. Look, I'm clapping right now for you. Very good, Anusha. High five to you. So, this benzodiazepine and barbiturates, okay, this is a class of drugs that we can use, okay, in order to treat epilepsy, right? Chale ji, class khatam. Just kidding, okay? It's not. All right. Now, okay, I've already talked about. All right, coming up to now the classes of the types of seizures that we have talked about already, and I described each seizure to you in detail. And now I'm just going to tell you the medicine that would be needed in order to treat it. Guys, take it in your mind that the best therapy is the monotherapy. It means that you're just taking one drug, okay? If you're taking multiple drugs that can produce an interaction and everything, okay? I have jotted down this thing over here in the third bullet point. You can always stop it and then read it, okay? The other important thing is this, that it can have teratogenic effects, right? So if you remember, teratogenic is all about the deformation of fetus, right? And we don't want that to happen at all. um, good, Rabia. We are going to talk about it. ठीक है? All right. Wait a minute. Rabia, look, when you were saying, I know I mistakenly slipped out from my mouth even that it's antidepressant. You see, when you are giving an antidepressant, it means that you're exciting. And if you're excited in this condition, so literally it will create a bigger mess. Okay. So we don't want excitation, we want inhibition. Okay. All right. So, guys, you see over here, we would be very careful of the teratogenic effect, okay? And the second thing which we would take care of is suicidal thoughts, okay? So, there's always a black box warning on the medicine, okay, on the packaging of the medicine, okay? And if you find a black box warning, so you need to take care of it very well, okay, because that's a serious warning that FDA actually ask the manufacturers to print on the packages, okay. All right. Now, talking about partial seizures, okay? Partial seizures, like I said earlier, it's localized, okay, and everything. I'm not going to talk more about it. And we have already discussed that the partial seizures can be of two types. They can be simple, they can be complex, right? And the drugs to treat them is either you treat them with phenytoin, carbamazepine, and lamotrigine, or you treat them with valproic acid and phenobarbital. Then, when we talk about generalized seizures, then there's sorry, tonic-clonic seizures, which is also called grand mal seizures. Okay, so the medicine to treat this is phenytoin and carbamazepine, topiramate, and other newer AEDs. By AEDs, I mean anti-epileptic drugs. Guys, I have already attached the video on YouTube, okay, that is related to types. All right, it's better that you first of all educate yourself for the types and then you watch this video if you're watching this in recording, okay. All right, then is absence seizures, which is also called petit mal seizures, okay. And to treat that, we need ethosuximide. Then we have valproic acid, clonazepam, lamotrigine, and topiramate. Then we have myoclonic syndrome. You know what is that, okay? And in order to treat it, we administer valproic acid and lamotrigine or the other newer drugs, okay? Then is the dangerous one, that is status epilepticus, okay. And in order to treat it, we administer diazepam or lorazepam in the IV form, okay. And then we give IV phosphenitoin, okay, or phenobarbital. So, mechanism of action, like we said already, right? We want to block excitation, okay? So, you see here phentoin, carbamazepine, valproic acid, and lamotrigine, they all do one task, and that is they block the sodium channels, okay? And they inhibit the generation of action potential. So, their effect is use dependent, that is related to their selective binding and prolongation of the inactivated state of sodium channel. So the thing is, valproic acid at higher concentration reduces low threshold T-type calcium current. Now, if you remember, uh, last year when I was teaching you about action potential and everything, I told you guys, and even I remember in the last semester, I told you guys that after reaching a certain action, after reaching a certain millivolt, okay, uh, what happens is after depolarization and after reaching a certain threshold, sorry, after reaching a certain millivolts, what happens is the calcium channels also open, remember? If you remember cardiac action potential, if you don't remember, you can always go back and revise that, okay? All right, so valproic acid, what it does is, earlier if it was opening up at plus 35, so it would lower it and it would start opening up the calcium channels at, let's say, plus 40, okay? So it's lowering the threshold, okay? So lamotrigine probably has additional therapeutically relevant action. Then is ethoxyzamide, reduces the low threshold calcium channel, okay? And then barbiturates and benzodiazepine facilitate GABA mediated inhibition. I think there is an entire lecture on GABA mediated medicine. So we are not talking about the mechanism here. I've just inserted the wordings here, okay? All right. Then we have phentoin and fosphentoin, okay? So phentoin is absorbed well after oral administration, but its rate and extent of absorption can be altered considerably by its formulation. So phentoin is 90% bound to plasma proteins. Hypoalbuminemia may result in a decrease in total but not free plasma phentoin. Thus, increasing the dose may be counterproductive and result in toxicity. Then phentoin is metabolized by microsomal enzyme. By the way, I'll give you a list. Tuba, please remind me. I have to post it in the Google Classroom, okay? I'll give you guys a list, okay? That what medicines are going to affect what microsomal enzymes, okay? Anyhow, so its plasma half-life is approximately 24 hours at therapeutic doses. In some patients, metabolic enzymes become saturated at low doses and half-life increases dramatically as the dose and plasma concentration increase, resulting in a steady state mean plasma concentration that varies disproportionately with the dose. Now we have phentoin may interfere with the test of thyroid function. So a steep dose response and low therapeutic index require that phentoin plasma levels to be carefully monitored. Okay. Then we have fosphentoin is available for parenteral administration as a replacement for phentoin. Fosphentoin allows more rapid loading, intramuscular administration, and IV administration with minimal vascular erosion. So the common adverse effects are nystagmus. Now, nystagmus is actually a vision condition, okay? And nystagmus is related to the eyeball movement, okay? When eye moves, let's say, left and right very abruptly, okay? And there's a repetitive uncontrolled movement of eye, okay? So the repetitive uncontrolled movement of eye is called nystagmus, okay? Then we have diplopia, and that is related to, or you can say diplopia, okay? And that is related to double vision, okay? Ataxia Absence, A means absence, okay? And taxia means movement, okay? So that is ataxia. Then slurred speech, blurred vision, mental confusion. Then we have erotism. If you remember, I told you all, I think, previously that this condition is about the development of facial hair in female, okay, just like men, okay, they develop that. Then we have gingival hyperplasia, and that is related to swelling of gums, okay. All right. So the rare adverse effects are with long-term use, coarsening of facial features with mild peripheral neuropathy and osteomalacia due to alteration of vitamin D metabolism. Now, peripheral neuropathy is about that uh, you can link it to paralysis, okay, that you can't feel your limbs, okay, that is peripheral neuropathy, okay, and but that's going to be mild, okay, not a complete paralysis, but numbness, you can say, okay. Okay, and that is osteomalacia, that is softening of bones due to alteration of vitamin D metabolism. So then we have idiosyncratic reactions, and these are the reactions of which you can say the mechanism is not known, okay. So idiosyncratic reactions requiring drug discontinuance, it means that you just don't know what is the wrong, what's wrong happening within the body, okay. You just need to stop it because you know that as soon as you started to take the medicine, this and that started to happen, okay. All right. Then we have fetal malformation, includes growth retardation, microcephaly, and craniofacial abnormalities, and is possibly due to epoxide metabolite of phentoin. So you need to take care, like I said in the beginning, that some of these medicines are teratogenic, okay? So we need to be very much careful, okay? All right. Then we'll talk about drug interactions. Like I said before, there are drug interactions. So phentoin stimulates hepatic metabolism by microsomal enzyme induction and thereby reduces plasma concentration of numerous drugs, including other AEDs such as carbamazepine and valproic acid, and some antibiotics, oral anticoagulants, and oral contraceptives. The plasma concentration of phentoin is increased by drugs that inhibits metabolism, hepatic metabolism. The plasma concentration of phentoin is decreased by drugs that stimulate hepatic metabolism. Then we have carbamazepine and oxcarbazepine. Okay, so carbamazepine has good oral absorption, but there is significant interpatient variability in its rate of absorption. An extended release preparation is available. So it induces microsomal enzyme and increases its own hepatic clearance, thus reducing its half-life from 30 hours to 15 hours. So gradual dose adjustment is required in early therapy, okay? So it is a drug of choice to treat trigeminal neuralgia. It is also used to treat bipolar affective disorder. Oxcarbazepine is a poor drug whose actions are similar to those of carbamazepine. Its activity is due to a 10-hydroxy metabolite with a half-life of 10 hours. It is a less potent inducer of hepatic microsomal enzymes than carbamazepine. Wait. Okay. All right. Then we have adverse effects and toxicity. So the common ones are diplopia, ataxia, GI disturbance, and the occasional ones are retention of water and hyponatremia, rash, agitation in children. The rare one is idiosyncratic blood distresses. So now you know the terminology. Idiosyncratic is about a reaction where you don't know the mechanism, and blood distresses is about the blood reactions, right? Okay, and severe rashes. Um, Wait a minute, everybody, please. Right. Okay. So we were here. When we talk about drug interactions, okay, so they induce microsomal enzyme and increase the hepatic clearance of numerous drugs, including phentoin, valproic acid, and glass, and ethosuximide. Okay, phentoin may decrease the steady state carbamazepine through microsomal enzyme induction. Plasma concentration of carbamazepine is increased by drugs that inhibit its metabolism. Wait a minute. Thank you. Okay. Now we have valproic acid. Okay. So valproic acid is also used to treat bipolar affective disorder and is used for migraine prophylaxis. What is bipolar affective disorder? You remember that? What is bipolar affective disorder? Hmm. Okay. I'm waiting. Okay, very good. Biphasic depression. Okay. Anybody else? I wish we were in class and we can talk more about it. Happy and sad both traits you can have in this condition. ठीक है. I think we also discussed this class in a lot deep detail, right? Good, good, good girls. Very good. And I don't know why there is zero contribution and answers through boys. I don't know if in the online classes I don't even know if I teach boys also. I just feel that I teach only girls. Even the attendance that I'm viewing right now, it's more girls and less boys. Tell them they won't be able to take exam, okay, if their attendance is not appropriate. Uh, all right, good. Good, Rabia, Benazir, and Amen, and Anusha, and everybody. Super proud of you all. Okay, so wait a minute. Valproic acid inhibits the metabolism of other drugs, including phentoin, carbamazepine, and ethosuximide. Uh, Divalproic sodium is a one-to-one enteric formulation of valproic acid and valproate sodium that is absorbed more slowly than valproic acid. Okay, so the adverse effects are GI disturbance and hair loss, weight gain, sedation, ataxia, tremor at high doses, um, idiosyncratic hepatotoxicity, okay, which is fatal in infants and in patients using multiple anticonvulsants, fetal malformations, okay. So this is spina bifida and orofacial and cardiovascular anomalies have been reported. Then we'll talk about ethosuximide. So it is related to the absent seizures, okay, and it is effective, okay, in very fewer of the patients, okay. So ethosuximide is often the drug of choice because of its greater safety. Valproic acid inhibits its metabolism. So the adverse effects are GI disturbance, fatigue, dizziness, idiosyncratic reactions, and blood distresses. Then we have phenobarbital at less than hypnotic doses is used most often as a first line drug for neonatal seizures, and for maintenance control of status epilepticus. On occasion, it is used for short-term treatment of febrile seizures in children. Then we have benzodiazepines. So diazepam and lorazepam are highly effective in short-term treatment of status epilepticus, and clonazepam is effective for the treatment of absent seizures. Clorazepate is used to treat complex partial seizures. Sedation is their major adverse effect. Then we talk about more of the anticonvulsant drugs. So we have lamotrigine, which acts like phenytoin and carbamazepine. It is used as a monotherapy for partial seizure. It is used for absent seizure, myoclonic seizure, and the Lennox-Gastaut syndrome. So its half-life is reduced by phenytoin and carbamazepine, and it is increased by valproic acid. Its adverse effects include headache, ataxia, dizziness, and rarely a rash that may be life-threatening, especially in children. Then we have, wait a minute. Okay. All right. Then we have, wait. Okay, we have gabapentin and gabalin and gabapentin. Okay, so this gabapentin, among other activities, increase GABA levels in the brain. Gabapentin is used as adjunctive therapy for partial and generalized tonic-clonic seizures. Its adverse effects include dizziness, ataxia, and tremor. Pregabalin, an analog of gabapentin, is used as adjunctive therapy for partial seizures. It binds to voltage gated calcium channels and reduces release of excitatory neurotransmitters. Its major adverse effects are dizziness, dry mouth, uh, blurred vision, and weight gain. So both are also used to treat post uh, post hepatic neuralgia, diabetic peripheral neuropathy. Pregabalin is used to treat uh, myalgia. Okay, so we have topiramate acts like phenytoin and carbamazepine and may also facilitate the inhibitory action of GABA among other actions. It is used as a monotherapy and as adjunctive therapy for partial and generalized tonic-clonic seizures. It is used for the Lennox-Gastaut syndrome. It is FDA approved for migraine headache prophylaxis. It suppresses weight loss and has been used to treat patients with eating disorders. So adverse effects include fatigue, nervousness, and memory dysfunction. Then we have tiagabine. It's used as adjunctive therapy for partial seizures. It inhibits GABA. And when we talk about wait a minute. Okay, all right. Okay, so when we talk about the adverse effects, okay, so the adverse effects are dizziness, confusion, and ataxia. Then we have live tyracity. Oh God. Okay, levitiractem. Okay, so its mechanism of action is not known. It is used as adjunctive therapy for partial and generalized tonic-clonic seizures, for myoclonic seizures, and adverse effects include dizziness, behavioral changes. Guys, I am totally aware of this thing that you must be thinking that, oh my God, Miss Faiza is saying like a name of a drug, and then she's telling a name of a seizure, and then she's going to other drug, and then she's telling two names of the seizures. So the best way to do is this, that first of all you list down name of seizures, and in front of that you list down the drugs of the name of the drugs. Okay, I'll try to produce it for you. Otherwise, any one of you produce it, send it to me, and then I'll upload that in the Google Classroom. Okay. All right. Then we have lacosamide acts by an undetermined Mechanism, it is used as adjunctive therapy to treat partial seizures. The adverse effects are diplopia, dizziness, GI disturbances, and headache. Then we have isogabine. It increases potassium channel opening. It is used as adjunctive therapy to treat partial seizures. Its adverse effects are blurred vision, confusion, and bladder dysfunction. Then we have rufinamide. It acts like phenytoin and carbamazepine, and it is used as adjunctive therapy to treat Lennox-Gastaut syndrome. So, adverse effects are vomiting, diarrhea, and sedation. Then we have filbamate. It is used very limited, okay, due to development of aplastic anemia and severe hepatitis with liver failure, okay. Then we have zonisamide. It acts at the sodium channel, okay, and possibly by voltage dependent calcium channels, and adverse effects are drowsiness, confusion, and rashes. Okay, I attached this here. That is it, everybody. Thank you so much. Uh, what I must advise you all is that you see, even in Lippincott, okay, in the summary, you can see that they have made a table, okay, and they have listed down name of Caesars, and then they have given the therapy, okay. So the table is there in the book, okay. Even I can produce a table for you. You just have to memorize it and learn it by heart, okay. Thank you so much, everybody. Take care. Allah Hafiz.